WFYI started out with a focus on educational content. We've added a radio service, and now, of course, we're in the digital space. So we've really moved from those educational beginnings to a focus on trusted journalism, inspiring stories, lifelong learning. It's really on multiple formats, multiple platforms.
Research shows that the complex
The work we're doing with side effects is there's superficial reporting at the surface, and then there's deep dive journalism. Deep dive journalism is expensive and it takes a long time. And that's what we do. To have reporters who spend multiple years becoming subject matter experts so that they can build on their knowledge rather than just fly in, try to cover a story and fly out is huge. It's headquartered here in Central Indiana at WFYI, but we have partner stations who work with us.
It's the worst it's ever been.
We have seen
You can hear it on stations all throughout the Midwest. If everybody had access to all of the information they needed about health so that they could make decisions that were best for them and their families, I think we'd feel like, what, home run. Really, there aren't many options for that. And side effects really came out of that we wanted to go deep and make sure we were really covering and providing information that people just weren't going to find anywhere else. But foundational support is what has enabled us to stay on focus for things like education and health. Education is another complex subject. It impacts everybody. And so we were able to take the things we'd learned on the side effects reporting for health and transition that into education and start putting a similar focus on education.
I don't know that anything could be more intimate in someone's lives than their health or the education of the people that they love. It feels very fragile at times. They worry about it. They want to make sure that their loved ones have the best outcomes.
The Workaround, Wrestling with American Healthcare, is a production of Side Effects Public Media.
Navigating American healthcare is complicated.
As we're writing the stories, as we're planning the engagement, we're checking back in with individuals, we're checking back in with organizations, with families, with schools. And then once the story is done, it is then our opportunity to go back to them and say, so what did we miss? And more importantly, what tools or assets do you now need to take action on this information?
You don't get that kind of reporting anywhere else. The public is involved in helping us set the editorial agenda. Content plus engagement to serve the people. I don't know anybody else who has that mission.